You are welcome once again to the series that I have always make sure comes out every Thursday, health series that will make our health better. There is that need for the continuous symbiotic relationship between you, the public, and the medical laboratory scientists, so that we can have a better health that will be helpful in monitoring our health, also in getting the right diagnosis. The confirmatory diagnosis is with the medical lab scientists, and I'm sure when that is done, it is very easy for us to really get well and better. Health is wealth. Knowledge is power. When you have these two, you have power and wealth. Agreed. Today's topic is more of this great concern, the cancer. Cancer is a serious problem. People all over the world fear cancer the most, and it's ranked as the second deadliest disease in the world right now. The cause of cancer from the various perspective viewpoint I shall expose, but it is a genetic problem that has to do with the penetrating of your DNA, that is the genetic makeup, composition of your genome. Everybody has that DNA in the nucleus of every cell. So there is also the germ cells that when it is affected, it becomes a familiar problem. It becomes something that is family problem. But when not, the cancer remains just limited to that particular person. It's at times something that has never been heard of in the family before. So I want to expose us to the causes, the way we can keep ourselves safe from it. Generally, it is a lifestyle problem. If you want to take it or not, you can understand when they said the nuns don't experience that breast cancer in a large scale, even if they experience it at all. So it's a lifestyle problem. Even cervical cancer is not a problem with none, the Reverend sisters, so to speak. But like I said, if you like what we are listening to, if you like my channel, if you like everything I do, just subscribe. So it's very easy for me to keep up with the standard that will empower you more, the standard that will make health very, very wealthy for you. So click on the like button, subscribe, and also press the notification button. You will be notified every time this program is out. So let us move into the basics that as I used to do every time. Very clear. Cancer, in-depth knowledge and diagnosis. Subscribe, like I said. Every Thursday, you will always have me presenting something that will be very, very educative and helpful to keep your health very, very top notch. Very, very well. Better than you've always been experiencing it before. The outline for today is basic knowledge of cancer. That is the lay people's view, the government view, worldwide WHO view, the clinicians view, medical laboratory scientists, and the pathologists. The laboratory diagnosis in full, and the treatment and pictorials. The lay people's view is, it is a cosmic disease. When we talk about cosmic disease, it's as if that person is the only member of the family that is having it. So more or less, you want to ascribe it to the punishment. At times you want to say is a punishment of the gods, but that is not for us to do. The herbalists are usually those qualified to cure it from the layman's perspective, and the orthodox is just a waste of money. That's the perspective. Many of these people mix the orthodox with traditional treatment. The herbal treatment applies ointment and eats. I remember one of my mother's friend who had to be eating even the cancer, the cervical cancer she had before she died. Treatment is focused on the affected organ, not generally on other parts. The government view, from the government perspective, we know government is more concerned. The effort is at early diagnosis, so that it's either the breast cancer is removed, that is to excise all the surgical removal, so that it does not spread to other part of the body or other organs. The self-examination women are taught, and that is a serious effort from government. The awareness is created by declaring a day or two for that specific cancer awareness. The effort is towards reducing the morbidity and mortality of cancer using the traditional methods of surgery, chemotherapy, and radiation. I'll come further to that to make that clearer. The efforts are concentrated at the secondary and tertiary health institution level. So when you are talking of these treatments, especially surgery, chemotherapy, radiation, you are not talking at the public health level, even though the disease is so dangerous, life-threatening, taking life all the time. Worldwide view and the WHO view is the definition of cancer is a large group of diseases that can start in almost any organ or tissue of the body. When abnormal cells grow uncontrollably, go beyond their usual boundaries to invade adjoining part of the body and not spread to other organs. The experience is very clear. The organs, it's generally cells, have a limiting what they call contact phenomenon. Once a cell grows to the level of touching the other boundary, the cell boundary, it stops growing. But with cancer cells, it starts multiplying on itself. So, and what it's doing is not productive. It's not really fulfilling any of the goals of the cell. So it is not a useful cell, dysfunctional thing, and occupying the space meant for normal cells. So you find serious pains because it's more of an injury to the body. Cancer is the second leading cause of death globally, accounting for an estimated 9.6 million deaths, or 1 in 630 in 2018. Lung, prostate, colorectal, stomach, and liver cancer are the most common type of cancer, and the breast cancer. So you can understand the United Nations Sustainable Development Goal that puts cancer in the goal 3, the target 3, that is Earth for all, reducing, creating awareness and reducing this morbidity of this and mortality of these diseases. So 3.4, that is the target number of that goal with the United Nations, to reduce premature mortality and the elimination of cervical cancer as a public health problem and global initiative for childhood cancer. The goal 3 generally ensures healthy life and promotes well-being for all at all ages. Ensuring healthy life and promoting well-being at all ages is essential to the United Nations. Non-communicable disease kills 41 million people each year. So you can understand that cancer is not communicable, equivalent to 71% of all deaths globally. Each year, more than 15 million people, 85% of these premature deaths occur in low and middle income countries. Clinician interest generally is to look for it, where using its endoscopy or colposcopy or any of these instruments that can really, not very invasive, it's invasive, but just to look at the growth, whether there is an abnormal cell growth, and that is when it starts collecting a biopsy for histology or cytology investigation. Usually the cytology investigation is does not need much of this biopsy. It's just the scraping that usually happen or what is produced. But the histology, you really need to do a biopsy. To excise growth before it becomes malignant or remove a whole organ by surgery, that is very clear. The tumor may not be malignant, it may just be benign tumor. When you say it's malignant, it means it can metastasize, it can move from that locality to other regions of it, so it starts spreading and devastating. To recommend for chemotherapy or radiation therapy once it is confirmed cancerous growth. These are facts that the doctor would not want the patient to suffer, and so it's just what they have to do to confirm that growth, because it's not, if the doctor has to remove every growth he sees, even the little mole on your face can become cancers. So you can imagine removing your face or doing surgery on your face, and what for what, when it may just be a benign mole. But you never can know whether it's benign or malignant until when the histology specimen is taken and confirmed in the laboratory to be benign. Classification. There are different categories of cancer cells defined according to the cell type. The carcinoma, the majority of cancer cells are epithelial in origin. That is, when you talk of epithelial, they are on the surface of the tissue. The cells are layered there, or outer surfaces of the body. The leukemia originates in the tissue responsible for producing new blood cells, the blood itself, most commonly in the bone marrow. There is also the lymphoma, myeloma derived from the immune system. The sarcoma originating in connective tissues, including fats, muscles. These are all connective tissues, and bones. You know they connect one part to the other. Central nervous system and the mesothelioma. This is where one is talking about the laboratory diagnosis. When you look very carefully, you will see that normal cells have something so uniform. Everything seems the same. You look at even the layer. This is the topmost layer, and when you look at the cells as they pile up, very good. But when you look at cancer cells, it's destructive. It has disrupted the regular things you see here, the regular cells. It is now growing anywhere. But these are cells that have seriously been affected, and they are not really conforming with the rule of contact. No, all these cells, they don't go beyond their contact. But this one is growing, even piling up to form a tumor, which will spread and become cancerous. The explanation from this picture we have here, the normal cells, you can see the nucleus. That's why I mentioned that cancer is more of a nucleus problem, the genetic problem. The genes, the DNA genes are inside the nucleus. So if anything penetrates to that area, whether a chemical, whether an organisms, whatever, every cell has the nucleus. So it's from there that it creates the problem. The body's defense usually is outside the cells, though the body can also produce interferons, or what you call leukine, that cytokines, and they tend to help to invite attention to that cell, so that the cell-mediated response and other T helpers can come in and make them exposed to phagocytes that will now remove them from the system, remove them from existence. So these are labeled. When you look at these normal cells, you can see that the nucleus are so defined, the cytoplasm is almost given enough space. But look at the cancer cells, look at the nucleus. The nucleus are so big, they are occupying even almost the whole cells. So that's part of what is examined under the microscope. That is more of a nucleus problem. The nucleoli are these dark spots, you can see, but when you look at them here, they are bigger. The chromatins are the gene themselves with chromosomes, so they are more. At times you find them even more. So the picture you are seeing immediately tells you, when you use the Haematoxylin and Eosin staining method, it tells you that this person is having something that will metastasize if care is not taken. So immediately there is such a cell or the organ or wherever it is located is removed. The surgery needs to be done to remove it all. But the first step is to cut, that's the biopsy for examination. The way it is done, I shall try. This is more or less how normal cells that are going to be cancerous starts. You can see the nucleus so regular and everything, but when it becomes hyperplasia, you can see more of this nucleus. At this level dysplasia, it is numerous, leaving very tiny space for the cytoplasm. And now when it's cancerous, it has this layer, it has broken the barrier and gone into the upper area. So that is how you can really understand how these cancerous cells really spread, they metastasize. These are sarcomas. This is to show all the connective tissues. Cancer can happen anywhere. It's not limited to anywhere. It can happen anywhere, and it can metastasize to anywhere. So the nerve vessel can be affected, blood vessel, fats, the muscles, tendons. So, but when these are affected, we call them sarcoma, soft tissue sarcoma. Explanation for tumor formation. Cancer cells have unique features that make them immortal, according to some researchers. The enzyme telomerase is used to extend the cancer life span, while the telomerase of most cells shorten after each division. The more, because every cell has to really proliferate, so after each division, it gets to a state that it finally dies out, eventually causing the cell to die. Telomerase extend the cell's telomerase. This is a major reason that cancer cells can accumulate over time, creating tumors. The causes of cancer cells are numerous. Apart from when you talk of the age, you talk of the lifestyle, smoking, alcohol, and what have you. There are organisms, that viruses that causes, and this virus, like I said, has to really penetrate the DNA. And when you look at viruses that usually are associated with cancer, they are DNA viruses. This infection with human papilloma virus types targeted by the quadrivalent vaccine has declined by nearly 2/3 among teenage girls since HPV vaccination was recommended in the United States. So it more or less proves that papilloma virus could be the causative agent of that cancer in teenagers. A long-standing association between obesity and increased risk of colorectal cancer in humans is another cause. When you overeat at a certain age, like I said, age is a factor, you start now having the cancer problem. There is greater level of leisure time. If you are not physically active and you spend so much time, they can develop, the risk of developing 7 cancer types was 20% lower among the most active participants. So you can see the test really proved that yes, cancer could be associated with sedentary life, or probably not doing so much exercise. So it is advisable to do physical exercise to avoid cancer. People who consistently smoke an average of less than 1 cigarette per day over their lifetime had a 64% high risk. So that has been the Surgeon General in some developed world has always labeled it. Even in Nigeria, we have it written that it's not helpful if you want to live for long. That is how to dissuade people from smoking, changing their lifestyle. Cancer is caused by certain changes to genes. Like I earlier said, that the gene has to be affected. The basic physical unit of inheritance. Genes are arranged in long strands, packed DNA called chromosomes. The body normally eliminates cells with damaged DNA. So that is the usual. But with cancer, you find that cancer continues to grow and is not eliminated as expected. Stem cell research also help to show how that there is this SSSP2 protein. It turns stem cells into cancer cells, where from the ScienceDaily.com, that is where that research was exposed. However, a lack of particular co-stimulated molecule that aid in the way antigens react with lymphocytes can impair the natural killer cell function, ultimately leading to cancer. That is self-explanatory, because the lymphocytes, the natural killer cells, will remove them. But when there is that synergy, I mean the kind of relationship that allows the natural killer cell to be dysfunctional, then the cancer cells will continue to kill. T cells are taught to use a dual receptor system when they determine whether or not to kill sick or damaged. If a cell is under stress, turning into tumor or infected molecules, including, are produced so that they can attach to the surface of the cell. These work to help the macrophages, the cells, and kill cancer cells. Cancer cells grow in the absence of signal telling them to grow. Normal cells only grow when they receive such signals. So you can also understand why cancer cells continue to grow unstopped, uncontrollably. They pile up and they create serious problems. Ignore signals that normally tell cells to stop dividing or to die. The process known as programmed cell death is not happening with cancer cells. They invade into nearby areas and spread to other areas of the body. That is metastasis. Normal cells stop growing when they encounter, just like I had explained earlier. Tell blood vessels to grow towards tumor. That is what the cancer cell does again. It to continue to get the blood supply and oxygen. It gives person information. Worldwide, the 3 cancers that killed the most people in 2020 were lung cancers, colorectal cancers, and the liver cancer. Now, just like I said, cancer in human internal organs, cancer can be everywhere. So when you look at the lung, the bladder, the pancreas, the kidney, the liver, lymphocytes, lymph nodes, stomach, brain, anywhere cancer can't affect, it can become a problem, especially when those areas are abused. And if what is used to abuse can penetrate the nucleus of the organ in that area. Treatment, like I said, involves the surgery. Once it is detected, the surgical operation is done. But before I go into the treatment, a little more on the laboratory diagnosis will help us to understand the role of the medical laboratory scientist. That is, when the biopsy is collected, the usual practice is to make it possible for it to be examined under the microscope. It is the microscope that does the major work. But how can you examine a tissue that is collected in the histology lab without and examine under the microscope without following the process of microtomy? What do I mean by microtomy? You have to slice the tissue to that tiny level that will allow for cells, individual cells, not pile of cells. The surface, the top side is very flat. You can easily examine it. That is like looking at the surface area. Is the surface area you want to examine. So the histology medical special medical laboratory scientists who specialize in histology would really have to take that biopsy, that specimen, and make sure it is fixed before waxing it. When you fix it, then you put it through series of alcohol so that the water is removed. The xylene is now put to mix with the wax, and finally you wax, so that the cells are now easy to use the microtome to slice through and get that thin that which would allow for staining easily and examination. So when that is done, you then go to the next process of, after sliding, you put it on the slide. The slide is now added something. It could be something to fix that tissue, that slice, that thin tissue that will be fixed on the slide. You can use alcohol or other fixate, things that will face it. Usually you can also eat to make sure that it sticks and it's not easily removed. So after that, you can go on to do the reverse alcoholization. That is, you want to now let it have the usual water to allow the stain to penetrate, and the counter staining, and eventually after brewing you counter stain, and eventually you can now see the nucleus. The nucleus, which is the area of concern, like I said, will now come out blue. So you see the nucleus very blue, and then what you want to examine is very easy to examine. The cytoplasm is very faint, pink, because of the eosin that is used as a stain. The haematoxylin is the basic stain. So these are the processes that you can do in the laboratory to get it. The same thing applies to the cytology experience, where the production it's more of a cell examination, where the usual is either by brushing or production naturally. You produce the specimen, and that has to go put straight on slide using this spatula. The spatula spread it on slide, and then the process of staining using Papanicolaou stain then goes on before finally examining. So the result, when it comes out and there is the confirmation of cancer, then the surgery could be the only remedy. Since it's still early and it has not started spread, the advice is to to yank it up, remove the whole organ. It's usually common with the breast, the cervix, and stuffs like that. The radiation is another method to radiate the cancer cells so that it will not spread. Then there is also the chemotherapy, where the patient has to take serious chemotherapy. Newer methods are this: biomarker testing for cancer treatment, hormonal therapy, hyperthermia, immunotherapy, photodynamic therapy. That is one of the latest. As in February 2019, medical scientists announced that iridium attached to albumin, creating a photosensitized molecule, can penetrate cancer cells, and after being irradiated with light, A process called phosphodynamic therapy destroyed the cancer cell, and that was the work of the University of Warwick. The stem cell transplant is another, where you go straight to the stem cell to start almost like a newborn baby. So if you